Jambo, I am Eric Omondi from Kenya, and we are here to pitch for Team Shujaa Kenya. I am living type 1 diabetes for close to 20 years. I grew up in the village, and the challenge is I complained and lived the science center for diabetes type 1 for over 2 years, and the only treatment I got was for malaria. And worse, my parents thought that I was under the spell of witchcraft or a taboo. When I joined Form 1 in high school in Nairobi City, that's when I got to be diagnosed with type 1 diabetes. And this didn't make things better. I went for another 10 months without follow-up and without treatment, as the healthcare workers then didn't know what to do, how to optimize my treatment and care. My parents went into denial, and my school nurse also didn't know what to do with me either. Until I joined a center supporting children and their caregivers living type 1 diabetes, that I got empowered. And today I'm among the champions and ambassadors living type 1 diabetes in the country. Next, I'll introduce Ian to take over.
Thank you very much, Eric. From what you're looking at is as a problem is actually inadequate of information that is to the caregivers and the patients. And they were looking to cover 5,000 people and above. That is with a minimum of at least 5 healthcares in the 47 facilities. We have people who have attempted to do this solution, but in vain. That's why we came up with this solution in order to achieve the main goal. The innovation actually here we're looking at is to provide real-time information that is linkages to clinical care, support and follow-up, and then provide a platform for parents and caregivers for advocacy and influence of policy and practices. Innovation here we're looking at actually is a patient, as you can see, the centric person, and the other stakeholders, including the trainers, the caregivers, even the people at the facility level. And yes, the major barriers we're looking at is that is activating of the patient and caregivers, and then sustainable of content development. And the enabling factors we are looking at in Kenya, we have very good, healthcare community force. And then we have very good connectivity, and existing policy for the government is quite good. The business model, here we have subscription basis, that is a partnership and stakeholders, data and planning policy, policy briefs, training and research. We're looking into starting this project in May and close it in January. That is where in May we're looking at data collection, and then in July we're looking at optimization needs and pain points for the interview. And then we're looking at developing a prototype, and then integration and doing a pilot, and then we do a full implementation in the 5 counties. Thank you.
With 2 minutes